Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
So I welcome Sonali to present her case, and then I'll take you through the entire journey of PIDs along with vaginal discharge. And I'm sure all of you will rock this. So let's start. Yes, Sonali. Over to you. Unmute, beta. Unmute. Sonali? Yeah, go on. Are you speaking? We can't hear you.
Mrs. X, wife of Mr. Y, age 28 years, working as a software engineer, belongs to middle class according to modified Kupuswami scale. She belongs to house number 789.
Just a minute. Sorry. I didn't share it. Just a second. Yeah. Yes, Sonali. Yeah, you can just repeat it once again for us.
Mrs. X, wife of Mr. Y, age 28 years, working as a software engineer, belongs to middle class according to modified Kupuswami scale, lives in house number 789, sector 21A, Faridabad. Her chief complaints are she is having lower abdominal pain for 5 days, fever for 3 days, and a vaginal discharge for nearly 2 weeks.
Lower abdominal pain for 5 days, fever for the past 3 days, and vaginal discharge for 2 weeks. What are the differential diagnoses coming in your mind?
Ma'am, she may have UTI, vaginitis, any
lower abdominal pain, fever, vaginal discharge. Yes, it can be UTI. Yes. What else?
Vaginitis.
What?
Ma'am, vaginitis.
Vaginitis. Okay, just plain vaginal discharge. Okay.
Yes.
That means local infection. PID. Yes, that means you're talking about lower genital tract infection and then upper genital tract infection. Both is a possibility.
Yes, ma'am.
And UTI. Okay. Anybody with any other diagnosis? I need a lot of differentials from the class. Okay, because we are just 2 people. I can forget certain things. She can forget certain things. But when it is a group of 7, 8 other people apart from us, we can have a long list of DDs. Okay, and I am here to tell you whether this should be included or this should not be included. This is actually the part of the entire discussion which all the examiners love, because maximum number of complaints happen. Problems happen here. Maximum number of judgment happens here, whether you're able to handle the DD or not. That tells the examiner about the candidate. How confident are you in the DDs? Why are you saying pros and cons for everything? There's a possibility of this disease. That is why it's a possibility of this disease. But at the same time, these features are not there. So it might not be my first diagnosis or differential. PID, UTI. See, salpingitis. See, okay, tell me what is the definition of PID? What is the definition of PID? And why is salpingitis different from PID? Again, Funda, everyone. Okay, endometritis, fine. Okay, you finish your DD and then you answer my question. When did she deliver? Okay, you don't know when she's 28 years old, right? Well, let's say she's not recently delivered, right? Infected polyp, RPOC, very good. I'm impressed with the creative minds of my students. See, are you seeing, Sonali, how many DDs now we have for the same case? People are with endometritis. If she's had previous recent abortion, suction evacuation, maybe RPOCs, maybe septic, maybe sepsis. She's in sepsis. Because we don't know the history. It's true. She's a reproductive age female. She might have had a recent abortion. You never know. endometritis, RPOCs, sepsis because of RPOCs, infected polyp, fibroid degeneration. See? Are you seeing? This is the reason why I love a collective performance. And see, all of them had this one different diagnosis. And look at the list now we have with us. Yes? That's the idea of a group studies. All right. Now I'm asking you, people have written down salpingitis as separate from PID. What is the difference between PID and all these chronic inflammations, uveitis, salpingitis? Is there a difference? Or they come in the same spectrum? That's my question.
And PID includes
everything, correct?
Everything is endometritis,
yes, so
salpingitis,
endometritis, very good. Includes, it's because pelvic inflammatory disease. Is PID same as that of infection or is it just inflammation? Again, a question.
It includes both infection and inflammation.
Okay, I can take it. Okay, all right. And what else was I saying? So basically, although few were thinking salpingitis, uveitis, endometritis are separate, no, it is not. It will come on the same spectrum of PID. And usually, PID does not only refer to pelvic inflammatory disease, it's also infectious diseases and the same, not exactly with inflammatory diseases, but yes, it's also including the infectious spectrum as well. Okay? So it will come almost in the same diagnostic panel. So usually PID, I mean the upper genital tract involvement, and vaginal infections, vaginitis, cervicitis, vulvitis, this is lower genital tract involvement. So better will be to say lower genital tract infections, upper genital tract infection, or local inflammation, upper local inflammation. And then of course all those DDs very beautifully which you have all said. Correct? Now, with these chief complaints in my mind, we'll set out to understand what was the history of presenting illness. Yes.
My patient was apparently well 2 weeks back. Then she developed a foul-smelling mucopurulent vaginal discharge. She had complaints of dull aching lower abdominal pain for the last 5 days, non-radiating and aggravated during intercourse. She was having fever since past 3 days, which is of low grade, intermittent, associated with chills. She was having dysuria and dyspareunia. There was no history of altered bowel habits, bladder habits, or encyclical pain. There was no history of any vulval irritation. There was no history of any pruritus, no history of any local drug application. There was no history of any allergy. And there was no history of any amenorrhea or missed period or any abnormal uterine bleeding.
So what I'm understanding is that 2 weeks back she was fine, and then she had some local foul-smelling discharge. 2 weeks back she had no other problem. That means no pain, no other vaginal discharge, which later turned into foul-smelling. Nothing like that. That means there was no. So it's a 2 weeks back history, correct?
Yes, ma'am.
Just 2 weeks. And then she started having lower abdominal pain later on, after she developed the foul-smelling discharge, correct?
Yes, ma'am.
And the fever is low grade, but she's also having chills. So after chills, she does not have a high grade fever. You mean to say that?
Yes, ma'am.
Okay. And dysuria, dyspareunia are present, but otherwise, so bladder habits are altered, right? So this will be gone. No history of altered bowel habits, correct? Because bladder habits. So what other problems she's having apart from dysuria? Frequency, urgency, any other problems?
No, ma'am.
It's a very essential history, Sonali, because if you said dysuria, this will be the next question. And if you don't add it as a negative history, I will not consider it's a complete history from you. So, no history of sorry. Yeah, no history of frequency, urgency, What else? Nocturia. But she can have, because she's having dysuria now, so she can have all this. Are you sure she did not have these things, or you did not ask?
Ma'am, I didn't ask.
So I'm presuming that there is a history, okay? So I will not write no history. I will write down that there was a history of all these things, because even if she's not having UTI, she can still have all these problems because that local area is in, in inflammation. So there could be an inflammation of the bladder as well, just the inflammation. So no history of frequency, urgency, nocturia noted. And what else? No history of altered bowel habits, no cyclical pain. Okay. No history of vulval irritation. Okay, vulval, okay. No history of pruritus. Okay. No history of any local drug application. Which one are you anticipating this to be?
Ma'am, like any steroidal application, like steroid.
See, steroidal will not lead to excessive pruritus. It quietens down the pruritus most of the time. So it could be any irritant drug which can cause local discomfort, which even includes your vaginal douches, vaginal irritants, vaginal perfumes, vaginal, any detergent of the cloth, even that. So any drug means any local application of anything which is foreign, including the talcum powder and like I said, the perfumes. Okay, no history of any allergy, no history of amenorrhea or missed periods or any abnormal uterine bleeding. Correct?
Yes.
Okay, moving on. Yes, is my voice coming with a lag to you, Sonali? Can you hear me?
Yes, ma'am.
So then go on, please. Menstrual history.
Menarche at 13 years. She had her last LMP on 15th of August 2025. Cycles were regular, with 28 to 30 days, having 3 to 4 days of flow of moderate amount, passing no clots and no dysmenorrhea.
Now, over here, you know what is important, because your case is PID and you've spoken about foul smelling discharge and all that. Can you tell me what am I anticipating for you to tell me here? Anyone? I want to hear something in menstrual history with a patient with this kind of, bad symptoms like, PID and local foul smelling discharge and pain, lower abdomen and all that, blah, blah, blah. What exactly do I want as a negative history? Or at least a history, especially when she's talking about menses. Perineal hygiene, changing the pads very often, isn't it? She's not using cloth, she's using a proper pad. Sanitary napkins, whether used or not. Don't you think all these things become very important suddenly in her case?
Yes.
So, history of usage of cloth, let's say, and not sanitary pad. Just I'm making your case up so that, your attention goes here. That's all I'm saying. Okay? Pads not changed until completely soaked. Up here you can also say local hygiene. Oh God, today I'm going to be, crazy. These students, last minute everybody is getting ready. Just give me one. Yes. So let's say local hygiene poor. Okay? Sonali?
Okay.
Yeah. Why am I, deliberately writing it down? Because your attention should go here and you can, impress your examiner with these few important things. Correct? So she was not using sanitary pad, she was using a local cloth. So now you know the fending factors. Maybe she was not changing it very often. And then, you know what happens with these cloth things is that when they have only a few supply, and then they dry it, and when they wash it, they dry it, and then they use it again. Sometimes they even use moist cloth. Sometimes it's not washed
Fully
properly.
dried.
Sorry?
They are not like washed properly and all.
Yeah. So the detergent keeps staying on, then it causes local irritation. So all these problems are a possible cause of local infection and even your upper genital infection if it's not being checked properly.